Hi, my name is Caitlin, and I am here today with Mark Hurley, one of our great PTAs over here at TherapyWorks. And we're here to talk about knee pain. So let's just jump right into it. We chose this topic for this time of year because oftentimes as we start to get into summer, we see a really large uptick in knee injuries and knee patients. So Mark, could you tell us a little bit about why this time of year is so hard on people's knees?
Well, for starters, people have been waiting throughout the winter to get off the treadmills and to get outdoors. And so you start to see people that may not be ready, or at least as ready as they thought they were or should be, start something new and maybe bite off more than they can chew at first with too far of a walk, too long of a jog, really heavy on the bike, or just try, hitting the gym again or going to the basketball court or the track. Plus, we also have the spring sports, which involve a whole lot of weight shifting, directional changes, contacts injuries. So it's not uncommon to see injuries, especially to the knees, because people may not have prepared themselves like they thought they were, and it's really easy to begin to feel a little bit more soreness or have a severe injury during this time.
Yeah, absolutely. So, you mentioned knee injuries. What are some of the most common knee injuries that you guys see around this time?
Well, when it comes to contact sports, if there is contact between players, oftentimes we'll have if it's medial or lateral, you might see meniscus tears, ACL tears, MCL tears, even fracture patellas. So if it's contact directly to the kneecap, you may have a fracture or a break to that, which can be very painful. So, and also misuse or overuse when people want to get out there and start to begin to work a little harder. That repetitive motion oftentimes can lead to an injury as well, or just the common strain or sprain from improper pivoting or directional change on the field.
Yeah, and especially if you've been doing treadmill running and now you're suddenly into changing directions, that kind of sounds like it might be, a little more stressful on that kind of thing.
Mm-hmm.
So are there, any types of knee pain that's not caused by, an acute injury that you guys see a lot?
Oh, yes. Actually, the autoimmune system causes an inflammatory response. So if it's such as like rheumatoid arthritis, osteoarthritis, that's kind of like your body's response to maybe saying, "Oh wow, knees increased swelling. I got pain to the touch to that area." That doesn't have to be an injury, or a fracture. It could be just a reaction that your body's going through. So oftentimes we feel like the common signs: heat, redness, swelling, pain to the touch. And that's just your body's way of fighting either an infection or just an inflammatory response. Oftentimes medication will help with that, and just some preventative measures.
Absolutely. So, what are some good, the big question that everybody's wondering about, what are some good ways to, avoid knee pain and knee injury, especially as you're, re-entering into maybe sports or outdoor activities this time of year?
Well, to avoid knee pain, I would say obviously at any level, proper stretching, allowing the muscle to stretch properly so that the joint moves properly. And that will improve just the normal range of motion and also the stability of the knee joint. Preparation could be, beginning to do some weight shifting training, pivoting, stepping, those kind of things to kind of test to see, is this stable or am I feeling some weakness in the joint? And then maybe speed changes, things like that you're going to incorporate with a ball game, soccer, basketball, that kind of thing, especially with high repetition like running or swimming, that kind of thing.
All right. So, a lot of the people who are watching today might already, have knee pain, which is why they're here. So, if someone's already experiencing knee pain, what are some good maybe stretches that help most often?
Well, some common stretches, if it's tolerable, squatting down or bending. So it's a stretch to the patellar tendon and the quadriceps tendon. So at the the end, if this is the knee. So it's getting the top of the knee and the bottom of the knee, stretching the quadriceps muscle at the above the kneecap, stretching the tendons behind the knee, so straightening the leg, doing kind of a straight leg stretch, quad set. So stretching behind the knee and on top of the knee, the muscles that are above and below the knee, the tendons that connect the kneecap and protect the knee joint. And you may try a little lateral weight shift and medial weight shift to kind of test the stability inside and outside of the knee joint as well. You could do that with just weight shifting, pivoting while you're standing, doing a 180-degree or a 90-degree pivot. Single leg stands also are kind of a good trial or a good test for you to see, hey, can my knee handle this if I have to jump or if I have to land on that, or do a quick positional change.
Yeah, the single leg stands, those, I always find it so funny when I see, people trying them out because, or even when I try them out, because you expect that you're so strong. And then that is one of those things that immediately you're like, oh, I didn't realize that this was a problem. But right away you realize how hard it is and like exactly where your weaknesses are.
Absolutely, yeah.
And, I should jump in here and say, all of these are excellent advice in general, but they might not be exactly right for you and your condition. So if anything is painful, or if you're concerned that something's going to cause pain or to worsen your condition, either stop or don't try it to begin with. Give us a call first, come in and, actually talk to a medical professional before trying it. But if it has, tightness pulling rather than pain, you're probably on the right track. But these are general and not specific for you, just a place to start that works for a lot of people. So, you mentioned some good stretches. What about, exercises that might help you out to kind of gain that strength around the knee?
Well, again, if you want to have a stable knee and a knee that you can trust, whether you're jumping or running, changing direction, some good exercises are to strengthen the quadriceps muscle and the hamstring muscle. Both are hamstring for the pulling back or the bend, and the quadriceps for the extension or the straightening of the knee. And then, of course, you wouldn't want to neglect the lower leg muscles as well, because if you've got the weak point in a closed chain, or when your foot's on the ground and then carries up to the knee, you want to make sure that your lower leg muscles are strong as well. So for some of those stretches, calf raises, mini squats, you're just standing and doing just a gradual light knee bend, little lunges if you can be a little bit more daring if you can have that tolerance. Also sitting down, we have those, you see knee extensions, we call them long arc quads, where you either have a little weight on the end and you just do those little kicks. Same way you can do a little resistance band and do the pulls when you're pulling the knee back. Hope you like my little diagram.
No, it's great. It's very helpful.
Yeah. And so, and again, there's closed chain and there's open chain exercises, but you kind of want to feel it out. And as you feel like the knee is becoming stable and trustworthy, then you can be a little bit more aggressive with the resistance training, or your position that you're in, whether you're laying down, whether you're sitting, non-weight bearing, or fully weight bearing.
Absolutely. So, just kind of moving along, we've talked a lot about, what to do if you have knee pain. But I know that, especially from, I played soccer and other sports through high school. And I know from that experience that a lot of times in, environments like that, knee pain is just kind of normal. Like it feels like everybody has some kind of knee pain. So if you're, someone who is kind of wondering, like, is this bad enough to talk to a medical professional, or is this the kind of knee pain that, I should just tough it out and it'll go away? How do you know when it's kind of time to come in and talk to a physical therapist?
Oh, that's a great question, because that's exactly what so many weekend warriors or really good athletes, so it's the same question they ask themselves. So in that, there's the old saying, are you hurt or are you injured? Is it pain that you can walk through or walk it off, or is it something that's not going away? I've made that mistake myself sometimes, where it may collaborate and not go away, and then you're in a worse condition than just the initial pain.
Yeah.
So if you have pain that is continuous, that's just pain. If you have pain that's continuous after the exercise or after the activity, that's one indicator for you. Also, the easier signs to see are the noticeable swelling, redness, pain to touch, or if it's just something that is just uncomfortable and it kind of wears off after a while, that may just be sore muscles or ligament strain, light, something like that, that can be remedied with ice or rest or just kind of backing off a little bit about either resistance training or what you're doing in that activity. So that's a great question, but it's going to be the severity of after the exercise and kind of assess, is this something that needs to be further looked at, whether a doctor or a X-ray, MRI, or a consultation from a therapist that can help you make that assessment with greater confidence than just guessing. It's not a good idea. You don't want to diagnose yourself.
Yeah, I mean, and that's a really good point. Like if you're worried about it, then, there's no reason not to get it checked out. And, I know that at least I have definitely had pain before that I thought would just go away and ignored it. And it was way harder to solve later down the line than if I just, addressed it right out of the gate. So, if you think that if you're in the boat where you're watching this and you're kind of thinking, well, something like physical therapy might kind of help, and I'm having some pain, I would perform a lot better or feel a lot better if it would just go away. What is the next step that they should take?
Well, here at TherapyWorks, we'd be happy to, do an assessment on it. It doesn't take long. It's not a complicated evaluation process. It could be just a simple range of motion, strength test, maybe a few maneuvers, and it's not rocket science. It can be something that can be easily diagnosed or at least recommended to get a further assessment from a medical professional. But if it's just something that you can kind of deal with, but yet it's not exactly the way you want it, we can also help with that as well, with improving your confidence in that. 4 weeks or so of some therapy where you build that confidence, you build the strength, the stability, improve your balance, improve your stamina. That it doesn't have to be a severe injury that you need to rehab for 8 weeks or 12 weeks or whatnot, but certainly a lot of things that we can help you with. And it all starts with just having someone give you a kind of a 5-minute, 10-minute quick checkup, answering some questions, and just a really non-invasive assessment.
Yeah, honestly, like I love our complimentary consultation system, because it's almost like, it's nice for me because I work at a physical therapy place. And so I can just, call up Mark and say, hey, Mark, I'm kind of hurting in my shoulder. I'm kind of hurting in my knee. Is this something I should be worried about? But not everybody has a friend who's a physical therapist or a PTA. And not everyone, just has that easy kind of access to a free sort of extra pair of eyes that's professional, that can tell you, yes, this is a problem, or no, it's not. So our complimentary consultations really let us be your, person that you talk to. And it's, like you said, anywhere between like 5 and 15 minutes. It's completely free. It can be in person or over the phone. And it's just a chance to talk through, what you're experiencing, what you've tried already, what you haven't considered. And, if physical therapy is the right next step, and that's what, if we both agree that like that's probably what you should go for, then we can get you right in. And, whether it's something minor that only takes a couple weeks, or something, bigger and more deeper problem that takes a little while to work through. Either way, we can work on getting you right in and started and, on the way to healing. But there, sometimes it's not physical therapy that's the right step. But TherapyWorks has been operating in Lawrence, Kansas for 28 years now. So, we know all the other resources. We know the doctors, we know the methods, we know what's available, and we can point you in the right direction if if therapy is not the right thing for you. So, if you're having knee pain and you're just kind of wondering like what should come next, is it bad enough? Is this something that can be solved? Is this something that I can go home and ice and it'll go away? Just give us a call, and it's a really good place to start. So, and we've talked a lot about, when it's better to come in, and like when you should kind of, like how people sometimes put off treatment. So, can you tell us a little bit about, why it's better to seek treatment earlier rather than later?
Absolutely. Just like you had said, it could be something small, but it doesn't take much to snowball. And again, this is the time of the year where people are they have goals for improving themselves or participating in a competitive sports or just for enjoyment. And so, starting early and getting it pinpointed and assessed and treated as early as possible, even if it's just something that we can move you in the right direction, that is so critical because it does not take long. Whether it's your back, whether it's your knee, whether it's your neck, it could be anything that's it doesn't take long. Our bodies are not perfect and we don't have lifetime warranties on our body parts. So we catching these early, even if it's something that's just a suggestion on changing something that you're currently doing, it's always better to be proactive and try these things first. Seek the advice of a professional. You may have a lot of experience in your sport and seen this before, and you may think it's going to come and go, but it's always great to have a second opinion, another pair of eyes on it, and plus we have a wonderful team here that with various amounts of expertise and seeing so many diagnoses that you may have never even thought of before that can be helpful for you. So.
Absolutely. And this time of year, we want to give you your summer back. Like, imagine how horrible it would be if you waited all summer hoping it would go away. And then suddenly it's September and now you're in treatment till October and now it's cold and you've missed, there's no reason to wait. Lots of reasons to not do though. So Mark, is there anything else you'd like to add before we sign off?
No, I just think that, we have a lot of experienced, seasoned therapy members here that would love to help, have a lot of experience with sports injuries and knee pain especially. So I would fully encourage you to take advantage of the complimentary consultations. We have time throughout the day, morning, afternoon, or evening, our hours, and we'll definitely be able to help you any way we can.
Thanks so much. So, if you're thinking that this is something that you'd like to take advantage of, or if you're just kind of interested in learning more, our number is 785-749-1300, and just give us a call. And thanks so much for joining us today.
Thank you.